We're welcome to have, we're pleased to have you here today at the this week's I Am program. It has been, yes, 1 year since we began these programs, and what a year it has been. I am trying, if I can, to make my machine come up with the right file. Discard that. Thank you. No. All right. So, um, my name is Mike Bullis. I always forget to tell people that. I am the executive director of the Image Center. We're the Center for Independent Living that serves Baltimore City, Baltimore County, and Harford County. But this program is a joint effort by many of the CILs in Maryland to get information out to you, to find out what's on your mind, to keep our finger on the pulse of Maryland and figure out how we can continue to improve our programs and how we can encourage the improvement of other programs. So thank you so much for coming. This program will be on YouTube in a couple days or so. And we'll edit it down and cut out all of the things I say that might get us in trouble. Um, you're going to be muted at the first, but we don't keep you muted. We let you unmute yourself if you feel like you need to say something. So if you want, you can use the chat box, which is basically your opportunity to type in comments while people are speaking, or you can raise your hand. And if my speech actually tells me you raised your hand, I'll recognize you. Either that or Heather might catch it over on her side. She is the doorkeeper protector, the woman who knows all in this whole situation. She can cut you off. She can send you into Zoom purgatory. I don't know where that is, but it's a scary place. You don't want to go there. So at the end of the day, we will have community announcements. If you have any announcements for your organization, it doesn't have to be an IL organization, just anything that is of interest to the community that you want people to know about. You have 50 or more people on here today, and possibly more now since we got started. We are transcribing this program, so you can check out the transcripts if you want a live broadcast or if you want a live transcript, it is there. Um, so here we are. Today we're talking about the 1 year anniversary of I Am. Um, we started this a year ago in June, and our thoughts were this. Our thoughts were we wanted to hear from people about where you were, where the programs you serve were a year ago, where we are now, in terms of our growth through the pandemic and what's going on, what's different now than it was a year ago, and then what do you see in the next year? What do you see? What are the outcomes going to be? Are they all positive, or have you got some process thinking about some of the negative things that we have to work on? So it's looking back, it's considering right now, and it's looking forward. And I believe there's I got confused here. So we have two people here. One of them has to leave fairly shortly. Is that you, Bong?
Yes, sir.
You're the person who has to leave shortly. Then we are going to hear from the illustrious and undaunted and abominable. I mean, excuse me, undaunted Bong Delasario, one of the people with disabilities in this community that is highly respected and always has interesting things to say. A local Baltimore native. Bong Delasario, what's been going on last year, this year, and what do you think is going on in the future with transportation and anything else you want to get in there?
Well, let's see here. As far as transportation,
What's your hang on? I did that was stupid of me, Bong.
it's okay.
Bong works for the Department of Disabilities as a I don't know what your title is, but basically kind of a liaison for transit issues around the state. Is that a fair assessment of who you are and what you do?
Yes.
All right,
So,
fire away, sir.
so again, like Mike said, I work for the Maryland Department of Disabilities. I'm the Director of Transportation Policy and Programs for the state. Excuse me, for Maryland Department of Disabilities. Um, as far as transportation goes, I mean, last year transportation was definitely, you know, at everybody's forefront, especially people with disabilities. Not just because of the pandemic, but if you needed to get somewhere, it was very difficult to get somewhere because everything was shut down. Um, MTA Mobility and the Washington area, WMATA, shut down for a couple of months and then reopened. Um, Same with paratransit for both systems. Um, since then, they had been trying their best to, do a social distance type ride for individuals. Um, and because there weren't a lot of people using the paratransit at that time, it worked out pretty well, even though ridership dropped dramatically because of the pandemic. People who did need to get out to their loved ones or to the grocery store or to medical appointments, it kind of worked out, pretty well for them. Um, you know, um, Now that things are starting to ramp back up and ridership is coming back up, it's going back to, I say, quote unquote, normal. Ridership has definitely gone up. There are still some things that could be worked on. There's still some things that could be improved on. Um, but they are definitely working on it. They are aware of some of the problems that have been going on, with the service as of late. And actually, I just had a meeting with them this morning, and like I said, they are working very, very hard, to try to get things back to a, I guess, normal state where rides are just flowing, appointments are just banging out. Um, and I think going forward, that's what we're going to have to do as well.
Hey, Bong, be
Yes.
specific and help us know what are the problems they're trying to iron out and where they are in the process.
So I think right now some of the problems are the the actual amount or length of time that people are on rides. There are some instances where there are some late pickups beyond the 30-minute window, um, and so forth. And just because of how economy has been going um, lately. There's been shortages on every aspect of it, not just in the transportation world, um, but just in jobs general. And like I said, they know exactly um, you know what to do and what needs to be done, and they're working extremely hard in doing that and trying to get everything back on track as quickly as possible. Um, However, I will say this as an advocate, if you guys are experiencing,
Come
um,
on.
hi, Chioki, as an advocate, if you guys are experiencing issues or problems, please, please do not hesitate to contact the complaint line or their comment line. Because unfortunately, um, and even if you don't think it's going to make a difference, the more people that advocate for themselves and let paratransit know that they're having issues, the bigger the response is going to be, the bigger or the quicker they can work to do something to make some changes. So again, if you are having issues, you know no one's better at advocating for yourself than you. So make sure that's known, even if you feel like it's not going to go anywhere. Again, myself as a user, I advocate for myself as well because I use paratransit. So if there's a problem, if I get picked up, you know, too late, I definitely call in just like any other customer, and I let them know, the date, the time, and what was going on.
Hey, Bong, there is a question in the or a comment in the chat box. Somebody says mobility has gone back to multi-pass carrying multi-passengers. They would appreciate having been notified of that before it happened. Um, how does MTA get its information out there so people know those kinds of major changes? And then I've got another question about I guess the other half of the question is if I'm a person with significant disabilities and I have maybe immune system compromised situations where I can't be around other people who have other than as minimally as possible. how do I get a mobility ride where I'm the only rider so that I can avoid the potential as much as possible of getting coming in contact with someone who makes me sick and I could potentially die? Is
Right.
there a way? Is there a way to
Um,
get individual mobility rides?
well, through the actual service mobility,
Yeah.
I will say probably not, but there are
Mhm.
some ways that you can limit the chance of you being on a crowded bus or around crowded people. But to answer your first question about the ridership and people or more people being on mobility rides at one time, so that has gone up only because the ridership has gone up. Technically speaking, ever since the pandemic started, there wasn't any type of rule to say, that MTA mobility could not pick up more than one passenger at a time. It unfortunately kind of worked out that way just because ridership was so low. And they did try to do it, on a 1 to 2 customer per trip basis, and they were able to succeed in that because the ridership was so low. However, because ridership has gone up, it does make it a little bit more difficult to get that one-on-one service or even that two service, just because of the routes, where people are getting picked up and where people are getting dropped off at. So that
Those-
again hasn't the quote unquote rule hasn't necessarily changed. Um,
It
it's
was just a
only seeming
circumstance
like
of
it
the
changed
situation.
because ridership is picked up.
Gotcha.
As far as your question, Mike, I mean, when you call MTA Mobility, you can certainly say, that you do have an issue, with other people, due to a health condition and so forth. They might be able to, depending on your condition, they might be able to set you up with a sedan. They may even ask you, if you can't catch a sedan, they may ask you, if you are a taxi access or call a ride access user, and they may suggest that you use the caller ride. Or if you're in a specific county like Baltimore County, they may ask you if you're a caller ride subscriber. So there are some, not always, guaranteed, but there are some workarounds if you are in that position. But unfortunately, as far as the service of mobility, unfortunately, it's not a guarantee that you are going to be a ride, even if you have those type of conditions.
What about DC Metro? Does anybody know what their policy is or how they're handling these kinds of things?
It's the same.
It's the same. Okay.
Yeah.
I mean, I'm advocating in this instance, like I say, for people who I understand that after you get the excuse me, after you get the virus, after you get the vaccine, after you get the vaccine, you're over 90% chance that you won't catch the virus and so forth. But for some people, that 10% is a big 10% because their health is such that even a mild case of coronavirus could kill them. And so I guess I'm advocating for those folks, saying we still need to think about them. It's not all about the broader population, and we still need to be looking hard at what solutions can be out there for those folks because they're in danger still. It's
Yeah.
yes, times are getting better for us, some of us, but not for all of us.
Right.
Hey
And
Mike, this is
this
Shannon.
oh
Shannon, go
I'm
ahead.
sorry,
How are
Siobhan.
you?
I'm
no,
good.
go
I'm
ahead,
good.
Shannon. Go ahead.
Thank you, Siobhan. So in DC metro area, they're still only allowing one person on the metro access vehicle. They haven't lifted that yet.
Oh,
Okay.
okay.
So they're still only
Yeah, that's
allowing
good to
one
know.
person. I know on the metro bus, they have removed the chain. So now folks can sit up in the front where, folks with
Yeah.
disabilities are sitting. They have done that, but Metro Access, they haven't.
Okay.
All
Thank you.
right, cool. Thank you very much. That's very helpful to us. It's Bong.
Um,
I haven't even. Hang on. We got Chiffon, and then we got to
yeah,
Siobhan,
get
yeah.
back to
This
Bong.
this will
Yep.
be quick. One of the mobility drivers, more than one, did tell me, at least for Baltimore County, Baltimore City area, that the reason why there are way more people on the mobility bus now is because a lot of drivers are no longer mobility drivers, so they're having real challenges with drivers and staffing, and that's why they're loading people up the way they're loading people up.
Yeah, the economy's really,
Yes,
resetting itself in that regard. Go ahead, Bob.
right. Yes, that is part of the reason why the rides have been overcrowded as well. And I see another question from Francie, which kind of ties in to what I'm about to say. So I did meet with the deputy director of mobility this morning, prior to this call. So again, they are working very, very hard to get more drivers out on the street, and to alleviate the amount of trips per one vehicle.
Yep. Okay, Bong, we haven't given you any opportunity to talk about next year. What looking forward? Are we just going to go back to normal as it used to be, or are there things that are going to be different, or what are your thoughts? Are you going to get married this next year and have a baby? And I mean, just general stuff.
That is very, 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 very far into my future. Like I can't even see that far. But
Fine.
with or without my glasses. But as far as transportation, I do see it getting easier. I do see it getting better. I do see it accommodating more people with disabilities and more of the older aged population as well. Again, I'm going to be perfectly honest with you. It's not going to happen overnight, but I do see it getting better. There are a lot of different things that are being discussed and hopefully worked on. Just to make things more accommodating, more accessible, and more frequent for people with disabilities, and easier for people with disabilities to get around Maryland. Not just per se Baltimore or DC or Montgomery County, but just in Maryland in general.
Sure. All right. Well, thank you very much.
Hand up for a while, Mike.
Pardon me?
I'm sorry.
Jade has had her hand up for a while.
Wait, I have a question.
Hang on a second, Kiyoki.
Hang on, Chioke. Jade
Hang
was.
on, Cherokee. I want to get to Jade because I just saw she also checked back in and said, I'm back. Sorry. So I didn't know what she was sorry about. And
I had to slip away for a minute there, and I thought that's when they're going to call on me. Like,
no, no, you're safe, Jade. It's you now.
No, so that's part of why I'm on the call today. Is there are significant workforce issues, of which I think that the paratransit situation is a symptom of the bigger workforce issues that we're seeing reported. And so at some point in time, I'm hoping that we can, during today's call, we can talk a little bit more about that, because I think it's really important to recognize that the parent transit issue is to a certain degree a symptom of bigger issues.
Hey, my liquor store delivers, my Amazon packages come on time. In other words, a lot of people shifted their occupation during the last year and a half in order to do it. So we can talk about it now if you want. Yeah, it's a huge labor shift. And now we're going to have to figure out how do you get those people or some new people back, right?
Right. Yeah, on multiple levels. And I'll be honest, I'm not convinced that just saying you don't get your federal unemployment anymore is going to be sufficient to sort of meet all of the workforce needs. And so the whole employment thing, now there are multiple layers emerging. The first of which is that capacity issue, and that a lot of folks shifted to other things. Some of it is wages, right? Direct support providers have had a very difficult time even before the pandemic competing with Amazon, right? I had a provider at a mental health nonprofit say to me, I pay, and they're one of the ones that pay better. So I'm not talking the lower end, they're like, I pay $14 an hour for our drivers. Now, mind you, they're driving individuals who are flight risk, may have behavior issues. So this is not sort of an easy, and I'm competing with Amazon, who's paying $18 or $19 an hour, to drive packages around. So that's how we were coming into this, with a really low unemployment rate, and a lot of competition. So there's that piece of it. There's also the piece of it that there's waiting lists at the Division of Rehabilitation Services. They haven't, since the 1990s, been able to serve everyone who's categorically eligible, and the wait list can be several years long. Doris has been working on trying to clean that up, and have been, I think, pulled about 50 people off that list. But then, so you have the folks with unemployment. So for the individuals with disabilities who maybe went out of the workforce because of COVID, they now need to come over to the America's Job Centers. But what we've learned is that the funding that's coming into the state for the return to work strategies, the state is merely a pass through. So we can't control or say you need to prioritize this population. And the local America's Job Centers may say, oh, you have a disability, you need to go over to Doors. Doors will say, yeah, but your wait list for services. So we are trying to come up with a strategy to capture, measure, and so forth. But there are multiple levels of things that I'm hoping to meet with the folks over at Paratransit, and we did this early on with COVID. Is the other thing that we discovered early on with COVID, to my surprise, is that the organizations that are serving, that need direct support professionals, paratransit and so forth, aren't also recruiting through the America's Job Center. So we're pushing all of these people over here who are told, now you have to go over here if you want to continue your state unemployment. And Lori, I would love to have the CILs get more involved with employment. And I think that you guys have already been doing a lot. So people go over to the America's Job Center. But if we're not posting the jobs there, then we're not connecting this whole workforce back to. And so one of the things that I want to find out is where are the paratransit contractors posting their jobs? Where are they recruiting from? Because I want to make certain that they're connected up with the America's Job Centers, so that as these folks are coming into the system. I also think we need to look at paratransit driving and use the opportunity to create some career sector pathways, because part of the reason why people cycle in and out, so there's the wages, but it's also because there's no clear pathway up, to other jobs. And so I would love it if we could figure out how paratransit the contractors could build a pathway that then moves them up into, some of the MTA jobs or whatever, as they acquire the skills and so forth, because I think we might be able to then attract in more entry level folks, so that we're constantly moving folks up and through.
And that's the big hole, isn't it? Our
Yeah.
economy, if you think about it, people are sort of hardwired to want, not all people, but most people are kind of hardwired to want to have a family and raise kids. And you can't do that on $12 or $14 an hour. And so that was our challenge before COVID, but now
and it's exacerbated even more.
Yeah.
And not being able to sort of put some parameters around, because the America's Job Centers under WYOA now have these performance standards. And so they are, even though they're not supposed to, making judgments about your inability to meet their performance standard. And if they feel like you might not be able to help them, then they're looking to try and pass you off. And we have to figure out how to stop the cycle of passing people off, particularly when they're being passed off to a place that we know, for many of them, there's nothing there for them,
Right.
So
Right. Yeah.
And I'm sorry, not to cut you off, Jay, but I do have to go in.
That's okay.
I just want to say one other thing. For at least, I can't speak so much for Metro Access, because I don't use Metro Access as much, but for at least mobility, another thing that you can try to do, and again, it doesn't work all the time, but it sometimes does alleviate the wait time, is when you're scheduling a ride, you have two options. You can either give them the time you want to get picked up, or you can give them the time you need to be to your at your destination by. A lot of times when I say, for example, if I have to be to work at 8 a.m., I will I will say I need to be to work at 8 a.m. Well, by doing that, the system automatically generates a time. Like when I set it this morning, because I have to be to work tomorrow, they set a time for between 6:35 and 7:05, based on how far it is away from my address, the time of day, and sometimes that does alleviate the wait. So I would strongly recommend that if you're going, especially if you're going to an appointment, put down the time that you have to be at that appointment. And sometimes you might even want to do it 10, 15 minutes earlier than your actual appointment time.
You
That
know what,
will,
Vaughn? That does, not to cut you off, but sometimes that happens with me too. Appointment time when I'm at work. And does mobility still does operate with appointments now?
it always has.
So I want to say something about that, being a person that's a wheelchair user and having to do that before myself. We all know that that system does not work. So I live, if I drive from my house to where I work, it takes 10 minutes. If I say that I need to be there work at 8 and they pick me up at 6, where
Yeah.
does that make sense? Now, where I work at, of course, I have a key and I can get into my office.
Right.
But most people don't have that option.
Right.
So
No.
folks are sitting outside,
Right.
folks are waiting in the rain, in the cold. The system does not work.
Right. No. 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 And I totally agree with you. You know, I wish I had an answer for that, Shannon. To be honest with you, because I mean, like you said, I mean, I could honestly, I could catch a bus and be downtown in 20 minutes. You know. However, if just knowing the way that the system is working right now, just to alleviate, especially if you have to use the system, just to try to alleviate and have some, even if it's just a quarter ounce of, okay, well, I'm sure they'll pick me up on time and I'm sure I'll get to my appointment on time. That's all I was saying. I'm not saying that it's perfect, and I'm not saying that you should
You're
do
saying
it
it's still
all
the
the
same old
time.
bad system. You're saying it's still the same old bad system we've always had.
Well, no, I would
know?
actually make the argument that it's probably worse. I had doctor's appointments on Friday. I spent an hour. I did all of the pre-paperwork and I spent an hour waiting before I even got called up to spend the 2 minutes handing over the sheet of paper that I needed to hand over before they saw me. So these workforce shortages are having an impact.
And
So,
everything that people have been putting off for all the year waiting for things to open up, they're going to try and do now.
Right.
yes,
Jade,
yes.
I didn't
And
ID you. I didn't identify you at all. Do you want to tell people who you are and what you do? I'm sorry. I just think everybody knows Jade Gingrich. So
I'm sorry. Really quick before
Well,
she
Bong,
does that.
Bong, do you need to hop off?
Yeah, I do. And I just wanted to say I am sorry that I have to go, but I do have a meeting at 3 o'clock that I have to get to. So I
thank you very
apologize.
much, Bong.
But if you guys have any other questions or concerns, Mike, Heather, they both have my email. So please feel free to let them know. Okay.
As
Well,
always, you've
Our
been very
floating
helpful.
bus
Thank you.
stop conversation another day, I guess.
Floating
Oh my gosh, look at that
Oh,
time.
wow.
Look at that
I'm sorry, I
time.
can't hear you. The line cracked up, Sarah.
Woo!
Ain't enough
That's what
hours in the
always
day.
happens.
Sorry.
All right. I'll talk to you guys later.
Yeah.
Floating bus stops
Bye-bye.
in a neighborhood near you.
And I can also circle back to Bong. For those of you who don't know, I'm Jade Gingrich. I am Director of Employment Policy for the Maryland Department of Disabilities. I've also been pinch hitting as Bong's supervisor, while Christian has been detailed over to work on the vaccine response. So Bong and I talk quite a bit and problem solve and try and come up with some strategies to try and figure out how do we get at, and I think that there's the ongoing issues with paratransit, right? And then there's the issues that are symptomatic of the bigger sort of world. So I think that Bong's sort of caution is a blanket caution across everything that we do right now. You know, you need to, as I was standing in the doctor's office, you know, waiting to get called, I thought to myself, boy, I'm glad I didn't back stuff up. Like the whole world is a little re-entry, exit was hard, re-entry is going to be hard as well across everything.
About
You know,
150 million
and
jobs,
so,
many of which just have to be retooled. Yeah.
yeah. So don't be surprised if paratransit isn't the only thing that you encounter issues with, and you know, and just sort of plan your lives accordingly across the board. It sucks. It is what it is. However, you know, we do want to try and figure out and problem solve and get the solutions and get things fixed as soon as possible, particularly as it relates to paratransit, and trying to figure out how we can get them the drivers that they need. You know, what's not clear to me is it because they weren't hiring? You know, because the demand was down and now the demand's amped up. Like what, you know, I'm not quite certain why it is that this is suddenly a problem. And some of that gets into that, you know, contractor state relationship, and contractors make decision, you know, what was the oversight, you know. I will also tell you that with the opening back up, you know, the state has opened back up as of June 1. The original plan and plans have been placed for July 1. And then a decision was made with a very short turnaround. So while it seems like we should have been able to plan for and anticipate some of these things, sometimes we're not given the opportunity or the time that we thought that we had to bring things back up on board as well. So, and I don't know if Bong referenced this, but one of the things that when I first came in as interim while we were in the hiring process, that Bong will tell you almost every time we touch base, I'm like, what's the status of the pilot? Because they
Oh, I'm getting in now.
Sorry, what?
I'm in.
Okay.
that MTA is supposedly preparing an RFP to go out that would be a pilot for a transportation access, you know, on demand. That would be a complement, not in lieu of, but a complement to the existing services. The other thing that you all may want to consider,
Hang on, Bob. I mean, hang on, Jade. You're triggering something in my head. I first heard about this idea of a pilot to talk about on-demand access for people with disabilities. This has got to be 2.5, 3 years ago. Is there any? Do you know anything that's?
So
I think it was a great idea.
The last we heard, so it got put on hold because of COVID. We heard that the RFP was supposed to be out in April. It has not gone out yet. And of course, now there's lots of transitions, but that's one of the things that we're tracking, because one of the things that I think that they need to get out as soon as possible is that RFP, to get that in place. One of the things that I think that we need to figure out, and I don't know if it's, I'm not certain that it's something that we can figure out under the state purview. So I'm not certain that it's something that Bong and I can do, but it may be something that you all can do. Is the Montgomery County area, Uber has wheelchair accessible vehicles. I guess it's part of a pilot or something. I know that New York City, in authorizing for Uber and Lyft to come into the city, because their taxi cabs had such strong control, they held them to requirements of wheelchair accessible vehicles. And I do think we need to look at strategies to ensure that these on-demand services, now they maintain that they're not the actual physical transportation, they're just the computer platform that makes those connections. And so all they have to do is be
they set up
with their websites. But I do think that there's more strategies that could and should be deployed, that could and should be looking at how to make them have in their cadre more accessible vehicles.
So
Well, maybe
we,
we've dealt with the Home Act at the state level, and that, you know, that passed last year. So maybe the new thing on our plate needs to be some of this advocacy for requirements of accessible levels of transportation in
so
communities.
sorry,
Go ahead,
you know,
Terry.
in Montgomery and Prince George's County, our staff have tried to utilize some of those platforms, and they have, you know, it takes a very long time to get a vehicle. So if you're trying to call an Uber because you have a doctor's appointment and you're saying, okay, I'm not going to use Metro Access today, I'm going to try this way instead. I know we've had staff that have missed appointments, been late for work because they're trying to use those platforms, and either the accessible vehicles, there's like one person driving an accessible vehicle, which meets the requirements, but then they can't get to our, you know, our folks to pick them up any reasonable amount of time. So there's a lot to be said. They've been piloting it. I'm sure Shannon, Rochelle, Serena, you know, some of my staff who are on here can speak to that, but it's not been an extremely positive, and it's very expensive. It's a very expensive way to go anywhere. We've also had the on-demand taxi service in Montgomery and Prince George's County, which they then took away because they couldn't manage it. It was too expensive. In the end, it just didn't work. And I'll let my staff speak to it. But just so you know how it's gone.
Well, but I think that those are some important conversations. And I think that part of the challenge is that it's so little, right? I mean, it's like if you only have 4 staff or 1 vehicle, like there's economies of scale, like, you know, and so that's why I think that, so I agree that it's frustrating and not working. I think we need to learn, and then that needs to inform and try and figure out, you know, are there other states that have figured this out? You know, what's the power? How can we make it affordable work and so forth? Because I think
Jay,
yep.
You familiar with taxi access?
Yes.
Yeah, I take that. And where do you live?
I live in Howard County.
Oh, I live in Baltimore County because we have through mobility here. We take taxi. I take taxi access.
We're running short on time. We've still got 2 other speakers. Okay.
Yeah.
Sorry.
That's what I was gonna say. I need to cut everything.
But see, I take taxi access to other things that I go to.
So here's
mobility is cut down.
So 2 things that I'm going to say in the interest of time. Then I'm happy to have a conversation with this group with other folks around the workforce issues to really dig into it. And Bong and I can also have another conversation with you guys around the transportation piece of it, as well as separate conversations, if that would be helpful.
I think it'd be great to do a whole episode on that.
Thank you.
Whoops. Oh, am I unmuted?
Yes.
Yes.
All right.
And now you have your camera on.
Sorry, I just realized my camera was off. I don't know why that happened. It was weird. Okay, my apology to everyone. You thought this was a radio program. Sorry.
The Michael Bolus radio hour.
I want to. All right, I want to apologize to our next speaker because I told her we'd get her right up, and then the conversation got away from us. Cecilia Warren, are you here? Or did she have to leave?
Yes, I'm here. I would like to yield the floor to Chelsea Heyman, and then I can go last if that's okay.
However you want to do it. I've just noticed that today appears to be the Maryland Department of Disabilities show, and we appreciate so much all that you guys do. We know you can't fix everything. We're not asking you to fix everything. What we're asking is what was the state of things last year? What's the state of things this year, and where do you hope to be next year? And we promise we won't hold you to any of that because we know that this is a moving target, this world we live in today. Fluidity in society is always difficult. Change is always difficult. And so anyway, before I say anything more, let's welcome Chelsea Heyman. Chelsea, thank you very much for being here today. Talk to us. Where were we? Where are we? And where are we going, girl?
Thanks, Mike, for that introduction. If anyone on the call does not know me already, I'll introduce myself. I'm Chelsea Heyman. I am the Department of Disabilities Director of Housing Policy and Programs. if anyone has been following housing for the last year, it has been quite a whirlwind of activity, as everything has been for our lives in the last year. So I have a lot of good and, not so great things that have occurred, but I will go through, give you guys some updates on what's going on at the federal level, and then kind of briefly touch upon some of the developments at the state level. So just to catch everybody up to speed, what's going on right now at the federal level with respect to housing funding is that the presidential budget request has been released by the Biden administration. It is a 15% increase in housing resources from what was indicated for fiscal year 2021. So this is tremendous, but also is partially related to the fact that this is the first annual spending bill that doesn't have the spending caps applied to it that were from the Budget Control Act. Some key highlights about housing specifically for people with disabilities. This budget has an increase in the mainstream voucher program funding from it's 508 million. That's for nationwide levels. And in fiscal year 21, it was only 314 million. So that's a pretty significant increase. And just for those of you who are not familiar with the mainstream voucher program, it's similar to a Section 8 voucher, but it's specific for a person with a disability. And local public housing authorities, as well as the state, receives these vouchers after, typically it requires an application process with HUD. They indicate that they have them available. And then the public housing authority or the state, they apply to receive those vouchers and are awarded a certain amount based on a predetermined formula. So that's one thing to keep, keep an eye on and kind of keep your ear to the ground for that as well. The 811 project rental assistance capital and the rental assistance funding, that increased to 272 million in this request. Last year it was 227. So it's not as significant of an increase. It kind of is indicative to me of the fact that there's a strong focus on voucher programs, especially with the new administration. And the new administration really is also focusing on potentially creating a universal voucher program. So therefore, essentially what that would be is that anyone who is eligible to receive a voucher would receive it, because right now I believe it's a very, very small percentage of individuals eligible actually are able to get a housing voucher to help pay for their housing. So it's not an entitlement program currently. Other things going on at the federal level, there's been a lot of investments in tenant-based rental assistance programs. A lot of the focus of those programs have been on serving people who are experiencing homelessness, domestic violence and dating violence, sexual assault, stalking, and human trafficking. Some other things to kind of pay attention to is the American Jobs Plan Act. There is a $318 billion investment in affordable housing infrastructure within that act. So some of that, just a couple of key items, 45 billion to construct and preserve affordable housing through the National Housing Trust Fund, 40 billion for public housing to rehabilitate and preserve public housing. So all of these things are tentative. I bring this up because I want to make sure that everyone is aware of what is currently being discussed at the federal level, and kind of to make sure that you're tracking some of these things, because this will certainly affect what is available in terms of state resources.
And if your email is anything like mine, you will get triggers in your email that say such and such a bill for housing is up for hearing. Contact your congressman. These are great opportunities for advocacy, because a budget is just a budget, right? It's just
right.
This is what we want, not necessarily what we're going to get. And so there's a lot of work that we as advocates need to do.
Yeah, yeah, that's Mike, that was going to be like my last piece that I mentioned. You already mentioned it, so that's good.
Okay, fine.
So,
Ms. Heyman, does child abuse count too?
what do you mean by that?
Well, you meant domestic violence with that bill you were talking about.
So there's so yes, domestic violence survivors. I mean, if there's a dating violence, domestic violence, I mean, a survivor of domestic violence could be a child. So, obviously the rental subsidy itself is going to go to somebody who is 18 years of age or older, since those programs are made for adults. But, if there's some kind of reason why, for instance, of an individual who is being abused by a intimate partner, and they have a child who's also being abused by an intimate partner, then these kinds of programs are set up to help that person have a way to leave that household environment.
As a personal matter, when I grew up in a household with a fair amount of physical and mental abuse, I used to say to my mom, why don't you just leave him? And she would say, I can't afford to leave him because we have depend on him. And I said, I don't care. I'll live on the street if you just leave this man. And she never did. But yes, child abuse is, I mean, these kinds of funds would help lots of families in situations where they just can't see their way out.
Right.
Yeah.
Right. Yeah. Agreed. And it's one of the things as well. There was special. This is from the American Rescue Plan Act. There was special housing choice vouchers. They were indicated to be kind of earmarked for people recovering from homelessness or at risk of homelessness. For some individuals who are within certain, subcategories of experiencing homelessness, if somebody is in an abuse situation, then they could be at risk of losing their housing because, if they have a partner that is violent towards them, then it could be that individual, they're not going to have a place to go if they're dependent on that person to be able to provide some kind of shelter. So, there's a lot of ways that can be looked at. And I think that, the point of it is that, there's a pipeline that exists for supporting this population. And, the state currently has the New Futures program is a bridge, kind of like a bridge subsidy for individuals experiencing domestic violence or some type of domestic abuse. So that's like a state specific program, but that creates a little buffer for a person to be able to eventually move out on their own and have their own place. So what I'm like just noticing trend wise is that it seems as if there is going to be a lot more funding invested in focusing on alleviating homelessness and also alleviating individuals, providing a relief for individuals who are experiencing different types of domestic abuse and violence. So at least so far, that's what I've seen.
I think the Biden administration wants to make a lot of these things happen. The question is going to be what kind of a dysfunctional Congress we have and whether it can get anything done. A lot of you might want to consider moving to Montana, Wyoming, or North Dakota, South Dakota. A lot of these very conservative states, if enough of you move there, we could just flip the Senate, Chelsea, thank you so much. Have you got...
Yeah, of course. I'll just briefly mention, like, another thing I wanted to talk about was the eviction moratorium.
Yeah, thank you. Yep.
So yeah, at the federal level, it is still in effect. There has been a couple cases that have happened nationally that have tried to challenge the moratorium, but it is still in effect.
What does it mean exactly?
So yeah, that's a great question. So essentially, tenants can't be evicted for situations in which they have had some kind of income loss or resources lost due to COVID-19. So that could be like now at this point, I mean, it could be somebody who has possibly lost their jobs, or maybe they could not work anymore and had to quit their job because they had COVID-19. Really what it involves is that a person has to, at the federal level, they have this, these templates for declarations. So the person submits a signed declaration to their landlord in order to have this applied to their situation. It doesn't prevent landlords from initiating eviction proceedings. So I just want to make sure that people know that. It's just that covered tenants cannot be evicted until the moratorium is expired. So that's really important to mention, because with courts having reopened, landlords are going to be submitting people for eviction. But a tenant that is in a situation where they're covered by the moratorium, they can't be evicted.
But they have to get a lawyer and go to court and all that, right?
My best recommendation is, if you're in a situation in which you think that, your rights are being violated, there's a couple different things that you can do. So yes, definitely contact, if you have you have contacts at legal aid or any sort of pro bono legal assistance can intervene. And the other place that you could go is you can file a complaint against a landlord if you feel like they're violating the moratorium. And there's two places that you would file that complaint. You could file it with the Consumer Financial Protection Bureau. You can also file it with the FTC, Federal Trade Commission. So
is there a state moratorium on evictions, or state or local moratoriums that we should know about?
So great question, Mike. Currently the moratorium that Governor Hogan put in place on March 16th, 2020 is still in effect, but it does expire when the state's declaration of emergency ends. So, and what that means is this moratorium in particular, it prevents courts from ordering the eviction of tenants who demonstrate their inability to pay rent was due to COVID-19. So that essentially, just to clarify that point further, Maryland law, it still allows residential evictions in courts to hold hearings in eviction cases. A landlord can evict you for reasons other than a failure to pay rent. So if you refuse to move out when your lease expires, which is tenant holding over, then they could file an eviction on you. Or if you're violating any provisions of your lease agreement, like a breach of lease. So, whether that be due to, behavior, due to whatever might be in the lease that you've.
So read that lease carefully, because your landlord will.
Right.
Right.
That's great advice. Definitely read your lease carefully. And if you suspect for whatever reason that, there might be some concerns regarding what is in the lease, or you have questions about it, there's a couple of organizations. The Maryland Fair Housing Action Center is the newly formed Fair Housing Center for Maryland. They are a great resource. If you have questions about your lease and you're not sure if something is legal, then they can also refer you to legal services providers to go through that with you.
Yeah, I want to say a word, just because we beat them up all the time. I want to say a quick word in support of landlords. I used to be a landlord. I can't imagine how these landlords who only have 2 or 3 properties and essentially don't get any reimbursement for the tenants being there for the last year. I don't know how they've managed, how those mortgage holds are working. In other words, can you get the bank to say, okay, we'll just forgive the last year's worth of mortgage payments? So it's not easy for landlords either. They're not all bad guys.
Yeah, and that's why rental assistance is extremely important. And most jurisdictions in Maryland now, and if the jurisdiction does not have their own separate rental assistance program, the state has one as well. So you can call, worst case scenario, if you have a hard time getting through to some of the state has a hotline. I'll provide that in the chat. You can also call 211 and they can link you up to the right person for the county that you're in.
Good.
Be able to access some of that assistance. And that's key to help small landlords as well, like Mike out. fortunately, the state has they have a very accessible and, useful hotline service to be able to provide information about that per county. So every county is a little bit different how they're doing it.
All right, we're coming up on 3 o'clock. I know there's reruns of Cheers that start at 3, so a lot of people are going to lose them. Oh, maybe that's not it, but I want to thank you very much, Chelsea. This has been an excellent presentation. Is there anything else you want to say before you end?
I think that's it, Mike.
Got it all. Thank you so much.
Yeah.
What about Cecilia? Did you want to add anything, or you just want to say yeah to what Chelsea said?
Ditto. Yeah. Oh, I think they all did a terrific job. I had done a little summary when you told me you wanted to know where we were a year ago.
Yeah.
Epidemiology wise, and I just want to tell you this for all of the progress that we have made in 1 year. But according to my notes from my epidemiology report from June 10th of 2020, on that day, there was 1,061 new lab confirmed cases, and the cumulative total was 59,465. Today, there were only 84 new lab confirmed cases. And a year ago, there were 341 outbreak investigations. Today, there are only 116. So we really are moving in the right direction and have built out this tremendous infrastructure for vaccination and testing. And it's been quite, it has been quite a challenge. It's been a massive mission that we have been supporting. And but I would say that it's really been a tremendous amount of teamwork.
Well, I'm looking forward to some of the after action reporting analysis that we're able to do so that when this happens again, and I say when because it will happen again, folks, I'm sorry to tell you that, but when this happens again, what have we learned? What do we know for the future that we need to change? I've been very concerned that mostly that 20% of the population with disabilities was sort of left out of most of the major picture in terms of how we deal with pandemics, and I'm hopeful we can focus in on that. But yes, we're making progress. I went Saturday to a friend's house, and we all sat out in the yard and drank beverages of our choice and hugged each other, and it was just so refreshing and so heartening to be able to just connect with people again. So we are making progress. I know we've lost some of our folks at 3 o'clock, but let me pause for just a second and see if anyone else has any community announcements. I want to thank you guys again very much. The Department of Disabilities really does, as a state agency, does try to do the best to make things work, and we appreciate all your efforts. So thank you,
Michael,
guys, for showing up. Yes, and Chioke. Yes.
Yes. Hey, yeah. So yeah, because I take taxi access to you, Michael.
Right. No, I do not.
Yeah, because taxi access will get you to other places since since mobility can't get so many people to other places since the pandemic.
Somebody said, Choki, that they didn't realize that there were speakers. There were kind of speakers in the sense that we asked some folks to be prepared to make some comments if they could to kind of guide our conversation. But
that was me, Mike.
Yeah.
That made that comment, Jade. I was just apologizing. I was like, oh crap.
No, it's fine.
That was an apology to my colleagues and everybody else, of course.
No. It was all good. Yes.
Katie, I have an announcement.
Katie Erke from Accessible Resources for Independence. What's happening?
So I put it in the chat box, but for those of you who cannot access the chat box, we are hosting a workshop for youth with disabilities in Howard County. It's it'll be via Zoom. Anyone between the age of 13 and 18 with any kind of disability, physical, cognitive, psychiatric, et cetera, the whole gamut. It's a 3-part training. We also have a parent orientation. And if you complete the training, you get a free Chromebook. So
Wow.
we hope that people will want to attend.
I
did not put contact info. Let me get the contact info. I don't think it pasted.
I've always
And
wanted a Chromebook.
if you have any questions, just let us know.
Thank you very
Thank
much,
you.
Katie. All right, anyone else have community announcements for your organizations, whoever they may be, wherever they may be? Speak now.
Don't forget about Club 1111.
And
It's
don't
gonna be
forget about,
this
when is it?
this Saturday from 6 to 8 virtual.
Yeah, the
From
league
6
is
to
gonna,
8, League for People with Disabilities. Yeah, and it looks like Amanda has something.
yeah, thank you, Choki. That's great. This Saturday, 6 to 8, Club
Yeah.
1111. It's a great resource.
Virtual, yes.
Hi
Amanda.
there, this is Amanda. We
Amanda.
have an art workshop at the Towson Arts Collective by people with disabilities, for people with disabilities, this Sunday from 3 to 5 p.m. That's Sunday, June 13th, up
Are you
at
guys
the
still
shops
over in
at
West
Kenilworth.
Pennsylvania?
I'm sorry?
West Pennsylvania Avenue, is that what it is, or where are you guys?
So they used to be on Chesapeake Avenue, but now
Chesapeake,
they
yeah.
have moved into the shops at Kenilworth, where the Trader Joe's moved.
Oh, great location.
So
Good.
yes. So second floor.
Are you on the mobility route?
So this is the Towson Arts Collective, and it's an art workshop. It'll be visual art and a DIY craft this Sunday.
Is this online or in person?
This is an in-person event, and there are 10 spaces. And you can register online. I put the information in the chat box to register.
Is the location on the mobility route, do you know?
Yes, it is. Yep, absolutely.
Oh, very nice. Thank you.
Absolutely.
Well, thanks for the announcement. I love it.
All right. Anyone else have comments that you want to make? We're past 3 o'clock, but there's no rule written down in stone anywhere that says we have to stop. Are there other comments or thoughts about where you were last year and where you are now, and what kind of hopes you have for next year?
Well, I would like to say that I'm one of those people that is disappointed in the 2-hour evening wait for mobility. But aside from that, I would like to say that all these speakers today have been excellent, and I would love to call them back for additional workshops. Wonderful. Thank you so much.
Yes, thank you all to everyone for being a part of this. These folks really do help put things together. So
yeah, I'm trying to recruit Jade to come back in 2 weeks.
there you go. So we have shows every 2 weeks now. And now next week is going to be an open discussion. No, really. I know we told you it was going to be this week, sort of, but it really will be next week. So please be here at 2 o'clock for the Independence Amplified Maryland IM broadcast. And we are really pleased to have you here. Thank you all very much. Enjoy your week and enjoy your next year, and think positive. Things are getting better. There's going to be some glitches in the system. There's going to be some bumps in the road, but we're coming back, folks. We're coming back. Life will go on. Thank you all, and have a good afternoon.
And thank you, IM Program Plans. You're awesome.